So, hello ma'am, good day. My name is Soriano and I am from BSN 1A. So, for now, I'm going to demonstrate to you how to assess a radial pulse. So, before that, assessment. Identify patient using at least 2 identifiers according to agency policy. So, sir, can you tell me your name and birthday to confirm your identity?
My name is Benchley and my birthday is January 24, 2006.
Okay, sir, thank you for your for that. So, next, review patient's EHR for need to assess radial pulse. For example, age, exercise, and medications. So, determine previous pulse rate and measurement sites from patient's record. Assess patients and family caregivers' health literacy. Assess for factors that influence radial pulse and rhythm. For example, age, emotions, and etc. Perform hand hygiene. Assess for signs and symptoms of altered cardiac function. Assess for signs and symptoms for peripheral vascular disease. Assess a patient's knowledge and prior experience with pulse measurement and feelings about the procedure. Planning. Determine expected outcomes and following completion of procedure. Provide privacy for patient and explain procedure and encourage patient to relax. Please, sir, please be calm and breathe deeply, okay? Obtain and organize equipment needed. Implementation. Perform hand hygiene and position patient in supine or sitting position. When patient was supine, place patient forearms straight along sides or across lower chest or upper abdomen. When sitting, bend patient's elbow 90 degrees and support lower arm. Place a wrist of fingertips of and middle overgrowth along radial or thumb side of inner wrist. Slightly extend or flex wrist with palm down and until strongest pulse was noted. Lightly compress pulse against radius. Losing pulse initially. Relax pressure so begun pulse was easily palpable. Determine strength of pulse. Noted whether thrust of vessels against fingertips was bounding. 4 plus, full increase or strong. 3 plus, expected. 2 plus, barely palpable or diminished. 1 plus, or absent or not palpable. 0. After palpating irregular pulse, look at watch seconds and began to count rate. So, sir, may I ask for your left hand and please sit properly. Turn palm down. 3 fingers growth and let's put into his radial pulse. help help the patient to comfortable position. Um, Discuss findings with patients and document according to agency policy. So, um, your result, ma'am, please. Your pulse rate, radial pulse rate is 78, and it is considered normal, sir, because the normal pulse rate is 60 to 100. Dispose of all contaminated supplies in appropriate receptacle and dispose of gloves if worn. Perform hand hygiene. Raise side rails and place bed in lowest position, lock into position. Place nurse call system in accessible location within patient's reach. Evaluation. Um, when assessing pulse for first time, establish radial pulse as baseline when within acceptable range. Compare pulse rate and character with patient's previous baseline and acceptable range for patient's age. Use teach back. Revise instruction if patients or family caregivers was not able to teach back correctly. Documentation. Document pulse rate and cite appropriately. Document pulse after administration and of specific therapies and as applicable. Document evaluation of patients or family caregivers learning. Hand-off reporting. Report abnormal findings appropriately. Thank you, and that's all for my demonstration in assessing the radial